I'm Ravi Duggal. I work with the International Budget Partnership as the country coordinator for India. I'm based in Mumbai, and I'm also associated with the People's Health Movement. See, healthcare globally, if you see all countries that deliver good healthcare to its citizens and provide universal access to basic healthcare, it's very clear that healthcare is viewed as a public or a social good. That is, it's not a commodity that is sold in the market, and you have different prices, etc., to enable to access it. So it is something which is the responsibility of the state, where it's largely financed by the state exchequer through taxes or social insurance, and citizens have more or less free access. And they contribute, those who work, they contribute through their earnings, either as taxes or as payroll deductions. So that's the kind of system that you have right across the developed world, all the OECD countries except the United States of America. Many developing countries are trying to emulate that model, and some of the recent countries which have been able to move towards universal access to healthcare are Brazil, you have Venezuela, you have Mexico, you have Tanzania closer home, not Tanzania, Thailand closer home, and so they have been able to kind of demonstrate. Now, Thailand and India economically are very similar. They have a similar kind of rural population and a much smaller urban organized sector, but yet Thailand is able to do that because there is a strong political will within the government to actually take that process forward. Unfortunately, in a country like India, that is lacking, and that is evident in the kind of health spending that we have in this country. So if you look at the health expenditure in this country, we are probably from the bottom, we are number 5 in terms of commitment of public resources to healthcare. So India spends about 1.2% of its GDP on healthcare, and of the total health expenditure in the country, about 1/4 is spent by the government. The rest is mostly out-of-pocket expenditures, including the poor people. The poorest section, the bottom 2 quintiles, probably spend close to 7 to 8% of their income on healthcare during a year. And if there's a catastrophe, then they fall below the poverty line, or the family gets completely economically ruined if there's a catastrophic illness where hospitalization is there and so on. So if we were to commit more resources to healthcare, the WHO says that any country which can provide reasonably good healthcare services to its citizens must commit at least 5% of GDP. So we are actually probably 5 times less in terms of making that kind of commitment. But we have done some calculations because India has certain economies of scale and advantages. We have lower drug prices in the country compared to other places. So given that kind of advantage, we have a large human resource pool. So given those advantages, I think we can actually provide good healthcare with just 3% of our GDP, which would be roughly be around 3,500 rupees to 4,000 rupees per capita. That is all we need to provide in terms of healthcare. And there are examples within the country, in some of the states, which actually you see that. States like Mizoram, Sikkim, they are spending around between 3 to 4,000 rupees per capita. Goa also. And no matter that these are small states, but they are able to achieve health outcomes which today are beyond even the SDGs that we are trying to survive, emulate to reach that target. So they have achieved all those targets because they have had this commitment in providing adequate resources for healthcare. And also another common element in all these states which I mentioned is that the private sector is very weak in these states. So naturally what happens is the state is forced to invest adequately for people's healthcare, and they do that. For example, Mizoram doesn't have tertiary care. So they have good primary care facilities, all positions are filled up, doctors, nurses, paramedics, but they have an issue. They don't have a teaching hospital within the state. So what they do is within their budget, they make provisions for sending patients who need tertiary care to Guwahati, to Calcutta, to even as far as Vellore. They give them airfares and provide for whatever other expenditures that are needed to seek care in institutions across the country. So I think that's the kind of commitment that the national government in India as well as other state governments need to make if we need to realize universal access to healthcare. Maybe in terms of challenges, I think one of the huge challenges within the country is that we have a huge private sector. Okay, and it's dominant. 80% of care, if you look at national figures, outpatient care is provided through the private sector, and increasingly even hospital care today is being diagnostic services are being provided by the private sector. So private sector has a definitive role. I mean, it's huge, and you have to do something about it. So how do you bring the private sector on board? So there are examples across the world where you can actually see how, for example, Canada. Now, in Canada, about 50% of hospital care is, so 50 or 60% is in the public sector, but the rest is purchased through a contracted mechanism, which is well defined, well negotiated. Those services are kind of accessed, are then available to citizens. So they're paid for their purchase by the Health Canada agency. So that is one example. I mean, in UK, a similar thing happens with outpatient care, where general practitioner services are contracted in to the NHS system, whereas hospitals are all owned by the NHS, and hospital care is within that. Yes, those countries are also facing problems because they are already spending almost 8% of their GDP or even 10% of the GDP on healthcare through the public exchequer. I mean, how further can you go in terms of committing resources? So they are facing challenges there also, and so waiting lists have gone up. In fact, they're even contemplating of sending patients. Canada and UK want to sign treaties with the Indian government so they can send patients to India, under this banner of medical tourism, and so that because it's much cheaper for them to fly in patients here and treat them. But should India accept that kind of a thing, because we are not taking care of our own citizens? So you have a huge, I mean, India contributes a lot to medical tourism, a lot of patients coming from across the world. But I mean, our own citizens don't get access to healthcare. So I think what is happening in states like Mizoram, etc., is something from within we can learn, and also take examples from Thailand and Brazil. Because they are also developing countries or middle income countries, and I think they will be better models to emulate than, say, Western Europe or Canada for India, because our resources are much more limited than those countries. And as I said, I mean, it's quite possible to provide universal access to healthcare within 3 to 4% of GDP.